A permanent solution would be either to do a root canal or to extract the tooth. Today, tooth decay is a very common problem, and it is as a result of infections and poor oral hygiene. I know what you're talking about. My hygiene is good. Fine. Then we are not talking about you. This does not only cause pain and discomfort, but can also ruin somebody's smile and appearance. Unfortunately, most people do not visit a dentist early. Why? Because they associate a dentist to extraction. However, we have a very close option to extraction, which we call root canal treatment, or simply a root canal. If you don't know what a root canal is, we have a video on that, and I have put the link under the description. Now, if you have a severe toothache from a decayed tooth, a permanent solution would be either to do a root canal or to extract the tooth. And most times I get asked by my patient, which one is the better option? Well, today we are going to weigh both of them, and I will let you decide which one is a better option. But before we do that, if you haven't subscribed, please make sure that you subscribe and turn on that notification bell so that you get notified each time I upload a new video. So for us to be able to tell which is the better option, I have decided to use 9 aspects that can help us to evaluate these two options. And by the end of this video, you'll be able to decide for yourself which is the better option. Aspect number 1, the process. Well, both root canal and extraction will require an examination. That examination is the one that will determine the extent of the damage and the actual treatment plan. Next, for both root canal and extraction, you will require a numbing injection. So whichever you choose, that is not the basis of choosing. You will definitely get a numbing injection for either procedure. In terms of procedure visits, in most cases, tooth extraction requires only 1 visit. On the other hand, root canal requires usually 2 visits, even though there are times when it is done in 1 visit, but most times it is 2 visits. Also, for other reasons, the root canal may be done in 3 visits, but usually it is 2 visits. Aspect number 2, visit duration. Well, for extraction, you require anything between 15 minutes and 1 hour, or probably more depending on which kind of extraction. Whether it is a simple extraction or surgical extraction involving the removal of a wisdom tooth. Root canal, on the other hand, in most cases takes about 45 minutes per visit. Aspect number 3, after the procedure. Well, most extraction wounds will actually pain you after the numbing has worn out. Just like any other wound you have in your body, it will pain you. But you don't need to worry about that because you'll be given medication which includes painkillers that will effectively control the pain. On the other hand, root canal will only give you mild to moderate discomfort. In fact, a majority of patients never feel anything at all. They will even be happy to tell you that I didn't take the medication that you gave me, which is wrong, but it is what it is. They assume because there is no pain, then there is no need to take any medication. But for the case of the discomfort, that can also be controlled by simple painkillers. After extraction, you will need at least 24 hours of rest to enable the healing process to start on a good foot. And that also means no exercising for 24 hours. Root canal, on the other hand, does not have any restrictions as regards to exercise. In fact, you can return to your work immediately after the visit, since the toothache that brought you for treatment would have already subsided and you are feeling much better. After extraction, the wound can easily start bleeding for various reasons, and that bleeding is a concern for many patients. On the other hand, root canal does not present any risk of bleeding after the operation. Aspect 4. After treatment care, what we call post-operative care. Extraction wounds will require strict care and hygiene, ranging from avoidance of spitting, no touching the wound, no passing the tongue, and anything else that will affect the healing of that wound. And this must be adhered to in strict terms, otherwise the healing of the wound will be affected. Root canal, on the other hand, does not need any special care apart from the usual toothbrushing and flossing. Aspect number 5. Chewing restrictions. Remember, one of the reasons you come for treatment is because you might not be able to chew well with a sick tooth. Well, after extraction, still you cannot chew from that side for all the period your wound is going to take to heal. And that could mean anything between 1 week and 2 weeks or even a month, depending on how you take care of the wound. With root canal, on the other hand, the restricted period of what you can chew with the tooth is just for the time you are still undergoing the treatment. And that is usually about 1 week. Because in this 1 week, your tooth is having a temporary filling, and that temporary filling can easily come out. So that's the only time you have restrictions on what you can eat with that tooth. If you are enjoying this video, please make sure that you give it a thumbs up. This will help the video to reach more people. Thank you for doing that. Aspect number 6. Risks of the procedures themselves. With extraction, the risks involved during the process itself are many, ranging from bleeding due to injury of a blood vessel or any other thing, to fracture of the bone depending on which tooth is being removed and how and who is removing the tooth, to possible paralysis due to injury of the nerve, and many others. Though these actually happen very rarely, they still do happen. Root canal, on the other hand, also has its own risks. The biggest one being the special instrument we use for cleaning the canals can actually break in there and fail to come out. In most cases, this is harmless, but it can psychologically affect the patient. In addition to that, this very instrument we use for cleaning the canals could actually pierce through the tooth and injure the tissues just surrounding the tooth and cause you pain. In addition to that, the disinfectant that we normally use to disinfect the canals could somehow spill out and irritate your gums and cause you sores and maybe even wounds. But as regard to infection spread as claimed by a section of people, that root canal helps to spread infection to the body. In fact, there is no slightest evidence to that effect. And as a matter of fact, tooth extraction has a higher likelihood of spreading infection to your bloodstream as compared to root canal treatment. Aspect number 7. Long-term after effects of the procedure. Well, with extraction, once the tooth is out, the remaining area where the tooth has been is going to shrink, and this is going to affect the neighboring teeth. They will start to shift, the attachment is going to lower, they can weaken, they can twist, they can bend and cause you malalignment. And this comes with a whole lot of other complications. If you want to know the full list of these dangerous effects of extraction, we also have a video on that, and I have put a link under the description. Check it out and see the full list of those effects. Root canal treatment, on the other hand, has no known after effects. Unless, of course, the root canal was not done well, which is not actually an effect of a successful root canal, but of a failed one. Then you might experience pain and you require retreatment. But with a successful root canal, there is no known negative effect afterwards. So that brings us to aspect number 8, success rate. What is the success rate of each procedure? Well, with extraction, once the tooth is out, it is out. The success rate is 100%. You cannot say the extraction failed. Then that becomes an incomplete extraction. But a complete extraction has 100% succeeded because the tooth is out. But root canal treatment, on the other hand, has a known success rate of about 98%. So 2% of all root canals will fail, and this will require retreatment. This is also the reason why us as Marvel's Dental Hospital, we give our patients a lifetime guarantee. If this treatment fails, we retreat free of charge, because we are aware that 2% of the root canals are likely to fail. Aspect number 9, the cost of treatment. Well, extraction is way cheaper than root canal initially, but not in the long term. The initial cost of root canal is at least 6 times the cost of extraction. And if you include the cost of the crown, then the cost of a root canal can be as high as 30 times the cost of extraction. However, after extraction, should it be that you have removed a tooth that is important and you require to replace this tooth, then your replacement options are either a bridge or an implant. Now, this bridge is at least 6 times more costly than root canal treatment. And should you consider an implant? An implant is at least 20 times more costly than a root canal. So now I'll let you decide which one is the better option. I would love to see your thoughts in the comment section below. And as you're still deciding on which option is the better one, please check out this playlist here, and I'll see you in the next video.